Morning or good early afternoon. Welcome to our next episode of the NASM Success Live webinars. Today is our 6th edition. Super excited to be here today and talk about the corrective exercise and how we can help all of you implement that into your current business. A few things to remember as everybody's logging in. We will have a screen at the top right. There's a little expand button. If you have any questions or any comments as we go through the PowerPoint or the material, please feel free to type in your questions. We do have a moderator standing by who's going to do her best to make sure we answer all of those questions for you today. If for whatever reason we miss a question or don't answer, don't worry. We will circle back with you within 24 hours to make sure we do answer all questions. Also, don't worry about muting your computers. They should be auto-muted as well.
So let's get started with poll 1 as people are still logging into the webinar. And what we want to know is, where are you in your fitness journey? A, are you studying for your CPT exam? B, are you actively working as a personal trainer? C, are you working with specialty clients? Or D, you're not a trainer, but fitness is your passion. So go ahead and take your time and respond to the first poll.
And we'll leave this up for a little bit as some more people looks like are logging in as we go as well. Another thing too, super excited about this topic is no matter where you are in the process, studying for exam, working with trainers, this is a really great tool to help you, again, if you're either starting a business, if you want to impact or grow your current business even more. So really good stuff. All right, so we'll go ahead and close that first poll, and then we have the results. So it's like the winner, 56% are actively working as a personal trainer, followed by working with specialty clients as a runner-up, so second place. So good stuff. Thank you again for joining us, and those of you that are working with specialty clients, hopefully learning a little bit more about the corrective exercise, which I know we'll dive into a little bit later. We'll hopefully you'll be able to take away from it and apply it immediately. So for starters, again, my name is Greg French, NASM Master Trainer and Senior Program Advisor. Been in the industry for about 12 years now, and I can tell you that actually corrective exercise was my first specialization I ever went after I got certified as a CPT, and made a dramatic increase in my business. So I'm really excited to share that with you today and how we can also give you those tools in your tool belt as well.
And my name is Prentice Rhodes, and I'm an NASM Master Instructor and also product manager, which I work directly with the corrective exercise specialization. I've been in the industry for 20 years, which means that I'm pretty old. I've worked as a chiropractor. I've been on the floor like many of you as a personal trainer, and I've also been a studio owner. And one thing that I've done with corrective exercise over my career is that I've used that as a bridge to move my clients from treatment, bridging them into their interests so that they can go out and perform to the best of their abilities. So I'm excited to share any information about corrective exercise with you.
And then again, we do have a free giveaway at the very end. So in order to win, make sure you're here to the very end. The winner of the raffle is actually going to get our corrective exercise all-inclusive program for free. Which one of us, probably most likely myself, will give you a call after the webinar to help get all that set up for you and taken care of. But again, we're really excited for you to be here as well. So being this time of year, this is probably my second favorite time of year in the industry, other than January where you get the mad rush. But what comes after the rush is you guys are probably seeing this, majority of you are already working as trainers. So you're probably already seeing clients in the gym, clients working out 7 days a week, coming in doing the same routine, beating up the same muscles, the same patterns, but you never see anybody focus on any of the important stuff like the stabilizers or focus on flexibility or mobility or recovery, which is really important in order to actually get those results. So this time of year, I can tell you from personal experiences, you would see a lot of clients fall off because they would get injured. They were not recovering. They were always sore. They're overtraining or under recovering perhaps, and not really getting that balance. So I was able to take corrective exercise and apply that to my clients to help with the recovery, which ultimately, if you recover, you're able to train at higher performance levels or higher speeds of volume or intensity, whatever it may be, which is ultimately going to allow you to take your client that much further in a program without beating them down, getting mundane about it, or feeling worn out or just beat up. So I do have another question for you here in our second poll, and we want to know what your thoughts are on who is corrective exercise best suited for. The 4 answers: 1, clients recovering from an injury; 2, athletes in their off season; 3, post-physical therapy clients; or 4, everyone. So we'll just give it a couple moments here and see what the polls are coming in as. I'm kind of curious to see where everyone's perspective is on this one, because it's
an interesting question.
Yeah. All right, so it looks like we got a good amount of response, and the exact response we were hoping everyone would go for is everybody.
That is the correct answer.
And again, it is for everybody. We're going to talk again how you can apply it for everybody, but also make it specific for individuals as you kind of dive deeper and deeper with your client base as well. So our next slide, I'll let Prentice kind of take over and start walking through the process of that.
Okay, so let's dive into the value of corrective exercise. So number 1, corrective exercise offers a recovery from a recovery workout opportunity. So the one thing that we all have in common, whether we're desk warriors, stuck in traffic all day, or whether we're elite athletes, is that we put our bodies under stress. And recovery helps us, number 1, re-educate the body to move us out of some of those faulty movement patterns. And for those of you who are athletes, recovery offers the body an opportunity to adapt to the stress that you're putting it under so that you can improve in your sport. Also, corrective exercise restores and encourages proper movement. Going back to that principle of pattern overload, whether you're sitting at a desk or doing repetitive movements from sport, you need an effective way to take your body out of those patterns so that you can continue to perform efficiently. Then you're going to improve your technique and reduce compensation. You're going to reduce the wear and tear. You may even reduce the risk of injury. And the most important thing is it will keep you doing what you enjoy doing for longer. Then corrective exercise prepares you for high volume and intensity. So when we establish the proper length-tension relationships and our muscles are coordinated and they have the proper endurance, this provides a base of stability. Well, guess what happens when you have that stability? You can become stronger because your body's moving efficiently. You're able to express your strength into whatever that activity is. And then on top of that, you're able to put that strength that you've acquired into power. So corrective exercise is not only a post-rehab opportunity for you, but it's also to get your athletes performing at their highest level. And you can also expand your client base. Now, how good would that be if you're able to communicate with your physical therapists and your chiropractors and offer your clients the same opportunity that I had when I started in the industry. You can be the bridge to take them from the treatment table to performing to the best of their abilities. So corrective exercise is a valuable part of your fitness journey, of your fitness business.
Yeah, and just to add to that, I can tell you from personal experience as a trainer, the first point he talked about is offering recovery workouts. So if your clients are coming in, which I'm sure all of you have clients come in and want to do extra homework or do stuff they shouldn't be doing. So I would actually schedule an additional session a week. So if I train somebody twice, I would schedule a third. If I train them 3, we'd schedule a fourth. And the whole workout was, okay, we're moving 90% of all load and volume off of you today. We're going to focus on moving through range of motion, full range of motion, because that's the definition of a healthy joint is can you move through all ranges of motion. We're going to focus on soft tissue work and flexibility and mobility to better prepare for the upcoming week's workouts, which was his second and third point. It's all about the preparation and recovery. But then again, other people in the gym are going to watch you see this. They're going to watch your clients transform, and they're going to notice, why are all of your clients always coming back and always adhering to a program and not complaining about injury? It's because we're applying corrective exercise. So it's going to help you expand your client base, which actually is going to lead us to our next poll that Prentice is going to go over with you as well.
Okay, here is poll number 3. How would you apply corrective exercise to your business? Would you A, add extra weekly recovery sessions? B, would you use this for movement preparation for high intensity workouts? C, incorporate a refined movement assessment process? Or D, all of the above? We are anxiously awaiting your answers.
Yeah, I'll be curious to see kind of what some people are going to take back from this and how we can apply it. And again, no matter where you are, we're excited to kind of walk through the fine details. And it looks like we got a good amount of response back. So we'll just give it a couple more seconds here. All right, perfect. So let's take a look at the results. So overwhelmingly, all of the above, which I think, again, is definitely the right answer. So you incorporate your refined movement patterns, your assessments, programming those in through the proper, obviously assessment protocols. So which is going to lead us to the next thing. So how can you use corrective exercise? And a lot of people have a tendency to think corrective exercise is a very limited scope, for lack of a better term right now, but we're going to talk, it's way more than that. So the first one is going to talk, I'll let actually Prentice start with this one.
And this is something that we've talked about already. You want to use corrective exercise as part of your well-balanced training program for recovery and self-care. I mentioned earlier, your recovery time is where your body makes it makes the adaptations to whatever it is you're doing for training. Also, during this recovery time, you want to have a vehicle to re-educate your body to move away from those faulty movement patterns. Mm-hmm. The second use of corrective exercise is a return to play model. Actually, the NASM OPT model was originally designed as a return to play model because athletes were coming from the PT clinic and then going right back into a traditional strength and conditioning program. And what happened as a result of that is they were ending right back in the physical therapy clinic.
And I can tie specifically to that. I was an ice hockey player myself, numerous back injuries, and never figured out why, but I would go from a treatment room right back to on ice, off ice conditioning, right back to treatment room, and just bounce back and forth. And so one day I finally had this proper strength coach who was certified in corrective exercise, and he was like, nope, we're stopping all that. He actually pulled me from the last 4 months of the season, and we focused solely on corrective exercise. It was the toughest workout program I've ever been through in my life, on focusing on proper movement patterns, retraining my body to move correctly through the range of motion versus being in this always fixed kind of hunched position in hockey where it's like, no, like your entire posterior side is weak and underdeveloped. Let's focus on re-strengthening that, rebalancing, getting that proper length tension relationship. Lo and behold, my next season was my best season I ever had. But again, it's that return to play. But again, when you think of return to play, please don't take that as a one-track mind. That can be for your weekend warriors. That can be for your grandma Jane who needs to walk up and down a flight of steps. It really is for everybody return to play, not just for sports.
And also, we mentioned this earlier, but you can use corrective exercise for performance enhancement. What you're doing is you're simply you're placing the body into the appropriate movement patterns so that you can express your strength and power. And here's an analogy. If you, for those of you who've been sprinters, I'm still a very good sprinter in my own mind, but if you are dealing with movement compensations and you're trying to apply that force that you need to come out of the blocks fast, and your body your body is going through some compensations, you're not able to express your power in the appropriate plane. So we want to use corrective exercise to help put our bodies in a position to be successful.
100%. Again, not only for athletes, for your weekend warriors, your grandma Jane, literally everybody, corrective exercise is used for. And the cool part is it's not overwhelming to apply. I know kind of some of the stuff we talked about, hopefully you're not thinking, boy, it's this great task. It's so complicated. It's actually not that complicated to apply and use.
So number one, let's talk about what you do with corrective exercise. Number one, it's an easy to apply system. And this is really simple. Number one, you are going to find the compensation through a variety of assessments. Most of you are working trainers, so you may be familiar with something called the overhead squat assessment. There are other assessments that you can use to confirm your findings from your overhead squat, but you're going to find the compensation. Then using that information that you get from your overhead squat, you're going to create a program. And number three, you're going to execute the program. And then you're going to, with that program, you're going to break that into 4 stages that cover things from reducing muscle tension to increasing your flexibility, then to re-educating the muscles and globally making your muscles work properly within various movement patterns.
And then the one thing as well to think about, remember, like he's talking all important points, but even more important, what corrective exercise is not, is one thing I have heard trainers talk about before in my experience is corrective exercise is not physical therapy. It is not pain management. So if you ever get in a situation where a client's like, I'm in pain, I'm feeling this pain, please do not try to be that superstar and solve it. Refer out 100% of the time. You made a point earlier about making those relationships with chiropractors and physical therapists, and I can tell you, I probably gained 80% of my clientele base from local physical therapists and chiropractors because I would take time out of my schedule. I would go buy them lunch, I would buy them coffee, and I would sit with them and I would tell them, these are my protocols. This is what I do with my clients. This is how I program, but I obviously know my scope of practice stops here. I want to build a relationship where if somebody comes in with pain, I want to send them to you to help get them out of pain, get them back to me, and that way we can work together as a team in collaboration. So please do not be afraid to refer out. You will never lose business from it. In fact, you will gain business from having those professional relationships.
And just like Greg mentioned, if you can foster those relationships, your phone will always ring. You will never be short of leads for your business.
100%. And one last thing too about the assessments is when you do your assessments, make sure they are always, would you say always repeatable no matter what?
Yes.
Always repeatable, so you have that fail safe and go back. It's the same assessment, different individual.
So let's talk a little bit about the corrective exercise continuum. This is a 4-step process. The first step in the process is we want to inhibit overactive musculature. Now, because of various patterns, there can be some concentric overactivity, or that means the prime movers are remaining tight, to use a simpler term, and through various mechanisms, whether that's the foam roller using vibration training, we want to tell the nervous system that it's okay to reduce the tension in that muscle. And next, we move into the lengthening phase of the corrective exercise continuum. And basic static stretching. We want to increase the extensibility of the muscle. We want to give the body a greater range of motion through the joint, because part of our goal with corrective exercise is to help our clients perform to a greater degree. So we want to increase the range of motion where it's appropriate through the joints. Then we want to activate the musculature. So that requires that the muscles have endurance and also a degree of coordination. And we would call that intramuscular coordination. And then finally, we want to integrate what that muscle has gotten from the activation phase into a greater movement pattern, or we can call that intermuscular coordination. And as you dive into the course, you may see that represented as some of our movement, or some of the movement subsystems.
And now when we talk about this process, Prentice, like the four, the inhibit, lengthen, activate, integrate, or strengthen, I know I've had trainers come to me saying, oh, I don't want to do it with my client, it's boring, it takes too long. But really, like, I mean, how long or how much time would a small system like this take out of a workout? Like, let's say if we're starting the workout, obviously you're going to start with this before you get into the meat and potatoes, but a rough time frame of a quick kind of going through this inhibit, lengthen, activate, strengthen, how much time of an hour workout should you program for this?
If the trainer remains focused, it should only take between 10 and 15 minutes to complete a corrective exercise program as the warm-up. The point of this is that you're not giving your client a canned warm-up. This is something that is specific to their needs. It's an individualized program, and if you do it properly, 15 minutes is all you're investing in that.
Cool. And I think that's very, very important to know, especially if someone's paying for an hour, you should be with them for that hour. You know, don't go run on the treadmill for 5-10 minutes, I'll be with you then. Now we're 10 minutes into workout. Get with them and great, like, hey, we're here, let's start. Do you need anything before we start? Then go right through the process. Like you said, it's a great warm-up. It's a great way to build even more rapport, but then also be seen like, oh, like I've never seen that movement before. People are going to come to you and ask you, like, what are you doing? What are you working on? Oh, well, I'm working on this, but don't worry, it's completely different for you because your body moves differently than hers, his, mine, etc. So keep that in mind. But speaking of this four-step process, that brings me to my next slide here. So, and again, I think this is something you can probably chime into. I know I personally have failed at it numerous times, and I see trainers do it. When they do assessments, we tend to analyze everything which way, up, down, left, right, all at one time, and we tend to get overloaded. But when he said it's an easy to apply system, it really is that easy. When you're doing an assessment, only focus on a select portion of the body from every certain point of view. Would you agree with that?
I would agree with that. First of all, it helps you focus, it helps you center your vision and only focus on the information that particular view is giving you. So for example, we have an anterior view up on the screen, and if I'm looking at this as a practitioner, I'm only looking at the space between the waist and the feet. My vision is not in any other region of the body. So, and you can apply that to all the other views within your squat assessment. Only focus on the region that pertains to that particular view.
So with that, take a deeper look at this picture. We'll leave it here for a couple more seconds and really analyze it. But remember what Prentice said, analyze that specific view, and then we're going to send you a poll and we want to see, what do you see in this movement compensation? And then this, there we go. And then we'll just give a couple seconds and let everybody vote as well. But again, if you're worrying about if you're going to see all the views, that's why we have the lateral view, the posterior view. I know myself, I always downloaded because it comes with the checklist, like the overhead squat assessment checklist, and I would just check, check, check. Do not try and decipher, oh, well, this is causing this while you're assessing. That's not going to change. Simply mark what you see. To his point, you analyze that and you create a plan after the fact. All right, so we'll go ahead and wrap up that assessment. And it looks like 87% feet turn out. So 100% correct, which is going to lead us to here. Again, so the feet are drastically turning out. And I know some of you might think, yeah, the feet turn out. Well, what if you squat and feet turn out? I think that's a whole nother discussion.
And let's go ahead and talk about that. You bring up a valid point. It's okay to go off track a little bit, but when we are assessing, when we are doing our movement assessments like the overhead squat, we are we are observing functional movement. Now, a great majority of our movement requires some sort of squatting motion, like running, stair climbing, and sprinting. And to direct your force in the proper plane of movement, so sprinting, for example, we want to drive and move in the sagittal plane. That foot should be somewhere oriented forward. Okay. Now, when we talk about the squat as an exercise, take powerlifting, for example, the goal of that sport is to move as much weight as possible. And there's absolutely nothing wrong with that. But when we look at the squat as it applies to so many other activities, we want to look at the feet pointing straight ahead.
And I think just knowing if you do, if you are a power lifter, for example, if you squat wider stance, just know if this, then this. So if I squat naturally with my feet turned out to generate more force or more power to move a certain weight, just know you're going to require some more recovery at the end of it and do more rehab or post-work stuff to make sure you're not permanently moving into that direction, but you're always returning back to that natural anatomical position as well.
One thing, and maybe this will help, one thing that a friend of mine told me, and it had always stuck with me, was it's okay to train in your sport. You don't have to live in it. You don't have to live in it. So for those of you who do enjoy power sports, it would also be to your advantage to spend some time recovering outside of the movement parameters of that sport.
Very good point. And now I know all of this is, okay, great, we've determined the feet turn out, there's this movement pattern, and the number one question is, what does that mean? What do I do with this information, which is going to lead us to the next step? Again, you follow the simple process.
Yes, it's a very simple process. The first thing we want to do is we identify why the feet may be turning out. That may be due to some extra concentric hyperactivity from the calves and to portions of the hamstring. So we want to inhibit. We want to inhibit that by foam rolling or using some vibration modality, whatever you enjoy using, to reduce the tension of those muscles. Then we want to move into the lengthening process, which we want to increase the extensibility or the ankle's ability to dorsiflex. So again, we want to focus on the calf complex and also some of the hamstring complex as well. Then activation. So then we're moving on to the opposite side of the joint, and we want to focus on the tibialis anterior. Its function is to help you dorsiflex the ankle. So we want to do some activation exercises to make sure that that muscle has the proper coordination, it knows what it's doing, and also that it has the proper endurance so that it can keep doing what it's supposed to do. And then we want to integrate that. And we have there a single leg squat and touchdown. We want to make sure that that muscle or that movement segment is functioning properly within a global movement pattern.
Yeah, and I think great point. It's one of those things too where, I've always done this myself and know my clients is, someone comes in really tight, say, okay, great, grab a foam roller, let's loosen up. But now once that muscle is now become loosened and longer, it doesn't have that same stability and strength. So you have to make sure you restabilize and activate it before you go put them under load. Otherwise, now you're going to cause some harm that is potentially worse than what they walked in with. Would that be another way to look at it?
I think so. Anytime you give the body a new stimulus, in this case we're inhibiting and lengthening, you want to re-educate. You want to re-educate the muscles to make sure that they're doing the proper thing with that new nervous system information, which is why doing the activation exercises that you described, doing the integration exercises are so important.
Yeah, and then another great thing about this too is it really does, like the corrective exercise, it dives so much deeper than obviously we're just talking a quick scenario here of the calf and ankle complex, but It really is cool. It was a game changer when I went through, because then I would look at my clients in a completely different point of view. I would look at them and I would just identify posture, but then I would also identify posture in movements. And you start to learn like, oh, like your shoulders are rounding. So I know this muscle and this muscle's job is retraction, depression. Well, that's not firing. So let's make a quick adjustment in the program. And now your programs just go to a whole new level of fun and exciting, because you start analyzing, oh, well, this muscle's not firing. This muscle's not firing. What's the common connection here? How can we make it better, more efficient? So it really is an awesome and fun program to go through if your brain really likes diving down that long rabbit hole of identifying those movement patterns.
And the most important part of that is the end user or your client.
Mm-hmm.
When you're able to identify those compensations, and you're able to take your client through that process, and you can objectively show them that they're getting better doing their favorite activities, that is something that's going to keep them coming back and utilizing your training, your programming.
And a great point there. And another thing too is when that happens, you're using the corrective exercise to really build your quote unquote your brand as a trainer. And again, this can be trainer in a facility, you can be independent, mom and pop studio, you can be assisting in a clinical environment. It doesn't matter what scenario you're in. It applies to everybody in this situation with building your brand and reputation, that you're now known as this corrective exercise specialist who's going to better help somebody improve return to play, but most importantly, quality of life. I think that's what triggered me to get corrective exercise. My first client I ever got, I'll never forget it. 85-year-old grandmother, had 2 hip replacements and like 3 shoulder surgeries and artificial joints everywhere, and just could not move. And I knew immediately I'm way out of my league. So I got the corrective exercise, which if you are interested in moving forward, we do have an 888 number at the bottom. Please give our program advisors a call. They're more than happy to walk through this in detail with you as well. But I got the certification and I analyzed, I did the assessments, and I'll never forget one day, a few months later, she come running into a session just so excited. And I asked what happened. And she's like, I went canoeing this week with my grandkids. And she goes, I was able to help lift the canoe and actually get my arms over my head to help put on top of the Jeep. And like, that was honestly the most rewarding thing I've ever experienced. And from that point forward, I knew corrective exercise was my calling. 90% of my business was all corrective exercise. And I started helping other trainers in my facility with their clients. And next thing you know, I made my entire career solely off that. So, we've even found that 2/3 of NASM trainers have said that adding an NASM specialization, again, it can be corrective, performance, whatever it may be, has set them apart from any other trainer, NASM certified or not, to help them grow their business as well. And I'm sure when you were a chiropractor, you would also probably look for those type of trainers when referring your patients out, right?
Yes, absolutely. Because something like that is it's very difficult to take care of all facets of your client care.
Mm-hmm.
So I can't stress how important it is to build a solid team around you so that you can focus on what you do really well. And hopefully after today, that's using the corrective exercise specialization as part of your overall training programs.
Yeah, and to get started with everything, I know it sounds like a lot. We started talking about everything, but we do have an offer for you guys to get started on the corrective exercise. I know we spoke about the raffle where we're going to give away one winner is going to win the all-inclusive corrective exercise for free, but we do have an option where it's 30% off. You can even start for $30 down, so don't worry about if you don't have the full amount to pay up front. No biggie. We're here to help you guys get started, because obviously we want to share our stories in relationship using corrective exercise and hopefully help you all have that same experience and really drastically make an improvement on your business. But the cool thing is we created a corrective exercise bundle. We put our heads together and figured, what are all the tools and assessments that Prentice mentioned earlier? There are multiple other assessments than just one overhead squat assessment. So we created a bundle. It's going to include options like manual muscle testing, positional isometrics, neuromuscular stretching, and goniometric assessments that are going to help you with the practical application side of the corrective exercise if you were to get started. Just make sure you mention webinar 6 when you call in to our program advisors, and they're happy to help, and then make sure we get you taken care of as well. Anything else to add about corrective exercise or the implementation of it?
I think it's It's a very simple process. I can't stress that enough. It's a very simple process. It's easy to apply. It's easy to apply, and you can help your clients achieve a variety of goals if you add this little piece to your training programs.
Yeah, and the number one thing, again, for me was how rewarding it was for my clients to come back in and say, hey, I just went downhill skiing with my family. My back did not bother me. I felt fine. I was going down the steeper slopes, and it really is an awesome tool. And like what Prentice said, I was so overwhelmed at first, but it's so easy to apply if you truly trust the process and follow the system of 1, 2, 3, 4. It's good to go. But other than all of that, we want to thank you for taking time out of your day and being with us here today. We do have our next part, which is our question and answering component. So we do have some questions here as well. So the winner.
Okay, so we have our CES winner, and this is Desmond Odin. Forgive me if I didn't pronounce your name properly, but Desmond Odin, you are the winner of the CES bundle. So congratulations. And how would Desmond claim his prize?
So Desmond, I will be giving you a call, most likely myself and or from a Tommy Martinez. I will be calling you within the next hour to make sure we get you set up with everything. If we miss you for whatever reason, we'll make sure we get in contact with you today to claim that prize. Our next question here, how long would it take to complete the CES program? So good question. I think on average time frame, what would you say, 6 weeks roughly?
6 weeks, yeah, that's a good time frame to go through the material and think about to pass the exam. But then there's another part of learning that's going to require you to actually get in the trenches and practice this live and actually apply it, which may take you a few more months.
I know when I personally went through mine, I stretched mine out a little bit further because I would read something on an assessment or something about a movement dysfunction, and I set all my study stuff down. And I went to all my clients, and that was everything I assessed immediately. So I would learn something, apply it, learn something, apply it, learn something, apply it. But remember, you have 1 year to complete the program, so please don't rush learning the education. Take your time, make sure you're truly absorbing, retaining, and learning how to practically apply the information.
So the next question here is, what's the best exercise or exercises to help with IT band tension? Now, we've been part of this this discussion about corrective exercise and using assessments and finding out what's driving those compensations. The answer is, and it's not necessarily the one you want to hear, but it depends. It depends on what's driving that compensation that's creating that tension of the IT band or tensor fascia lata muscle. Yeah. But again, going back to the process, I would inhibit the tensor fascia lata, do possibly some hip flexor stretching, and then I would think about what may be inactive on the opposite side of the tensor fascia lata, which may be glute bridges or clamshells or anything of that nature to help establish the proper length tension relationships in the joint.
Yeah, and then another thing to add to is we mentioned earlier is we're not treating pain. So Correct. If somebody comes in with pain, like don't go chasing after it. Stick to the protocol, do your assessments. If you're able to inhibit a muscle, lengthen it, activate the opposing reintegrating. If it doesn't fix what's going on, again, refer out 100% of the time. A good question though. All right, so next question here. Is it ever okay to work out a sore muscle from a previous workout, even if it's only a little sore? Got anything on that?
Wow, that is Is it ever okay to work out? Well, first of all, I would never recommend that anyone works out in pain, because it's one thing that we want to stress, is that pain is information that just, I don't know what's causing it, but something is off in the system. Now, it is okay to take that body through, take your body through a range of motion, but if you are feeling sore, you may want to reduce the intensity. Think about, if you wanted to work out, do something like dynamic stretching, utilizing the same movement patterns that you have planned, but I would avoid putting that musculature under the same amount of tension.
Yeah, so think about option one that Prentice mentioned earlier. Use it as a recovery. Maybe analyze, do you have a balance throughout your week or through your micro or mesocycle of a joint action? Maybe you're not properly balanced, so reanalyze that. Bring down the volume some. You'd be surprised that bringing down the volume can actually make faster and greater gains than pushing heavy volume.
Yeah, absolutely.
All right. Should you choose static stretching over a dynamic warm-up when dealing with corrective exercise?
Again, this answer is this is an it depends question, because it depends on the athlete, and I'm considering everyone, your grandparents all the way up to your elite athletes. Depends on who you're working with at that time. If someone has poor neuromuscular control, doesn't have a very good athletic pedigree, and maybe static stretching would be more beneficial. Also, in that group, if your athlete is coming off of an off season and needs to recover, static stretching may be more beneficial than dynamic stretching. If you're using corrective exercise in preparation for a higher intensity workout or a sporting event, dynamic stretching may be a better option. So you really, what I want to stress or challenge all of you to do is start to think a little bit broader. Think about these situations that you're applying the corrective exercise tools, and sometimes those answers will present themselves to you.
Yeah, good question. Next one here, how can I apply my CES specialization in a group fitness setting? Good question. I have a little bit of feedback on this one. I actually taught a couple group classes here and there. I taught a cross-training class, and what I would do is I would always analyze my workout before I got there. So I would say, okay, what do I have planned? I would look at the joint actions. If I have a lot of hip dominant movements during that session or that group class, then I know, okay, well, how can I better use corrective exercise to not only prepare my clients or my group of individuals to better perform, but also recover. So if I'm doing a lot of hip dominant, well, we would start by going through maybe some hip flexor opening stretches. We would start by activating some glutes by doing some lateral band walks, some bridges, some planks for core activation. And then we get into the meat and potatoes of the group session. So I know I've primed and set them up for success from a movement perspective. Obviously dealing with 10, 20, 30 people gets a little tricky, but you go off the general, what are we using from a joint dominant perspective, I would say, and Prentice can chime in here as well and go a little bit deeper.
So this is actually a good question, because I've had to do this. Like I said, I was a studio owner, and during at any one of my classes, I could have between 10 and 20 people. But one thing that I did was, before anyone could be part of my classes, but everyone had to come in for an assessment session first. And out of that assessment session, we came up with their compensations and their corrective program. Now, everyone had a card or a notebook or whatever, and they understood which muscles they needed to work on specifically before we hit the main part of our workout. And what I did essentially was I was I was a glorified timer because everyone was working off of their own sheet and going through their own 4-step corrective process, and I just timed them to keep the class moving. And I counted reps when we got to the activation and integration portions of our workout. But again, be creative. Get your clients into assessment sessions, and then it will benefit them, and it'll also be very cool because then your clients will talk around the room, and everyone's interested in what their individual corrective programs are. So use that skill to plan more sessions into your business.
He said a very good word, individualized. Use that when you market yourself. I'm a corrective exercise specialist. Our assessment's going to help me create an individualized plan for you. So the workout and the movements I give you is completely different than what I give Prentice, which is completely different than what I give me. So it really does help distinguish yourself as specialized and truly different from a skill perspective than any other trainer. So leverage it and use it. Do we have any more questions? No more questions here. So with that, we thank you again for taking time out of your day and being here with us. And we're really excited we got to talk to you about corrective exercise. I know I can probably speak for Prentice. I know I can speak for me. It's my favorite course we have. I absolutely love it. So I really hope you guys take advantage of it, get involved in the course, and start applying it right away.
Yes, thank you so much for your time and attention. And I hope that you are able to put corrective exercise into your training programs as soon as you get the credential.
Thanks, everybody. Have a great rest of the day.